For today's discussion, we're going to cover exchanges, subsidies, and Medicaid. All participants will remain in listen-only mode and can direct questions directly online through the webinar access. So similar to a few weeks ago, we started off by talking about Apex Benefits' approach to healthcare reform and helping employers understand the landscape, analyze the financial impact, determine company and employee impact, and align with business strategy. Today we're going to continue to focus on understanding the landscape specific to exchanges, subsidies, and Medicaid expansion. Today's focus for exchanges, we're going to cover a general overview, give some information relative to public and private exchanges, noting the differences between both, and discuss the process and notification that the exchanges and the administration will be responsible for. We'll also talk about subsidies, eligibility requirements, and who can qualify for subsidies, give you a perspective of household income distribution, and also an employer perspective in terms of what they will be seeing from employees and household incomes and how that relates to their employee benefit programs. And then we'll touch on Medicaid qualification and Medicaid expansion across all 50 states. So to begin with, PPACA mandates the establishment of state-based health benefit exchanges. Currently, states have 3 options to comply. They have the choice between state-managed exchange. Currently, there are 19 states that have declared that they will, on their own, independently manage a state exchange. There's a federal partnership, which states and the federal government will share in administrative responsibilities. And then we have the federally based exchange, where the federal exchange will assume all administrative responsibilities and the states will participate with insurance companies and benefit programs. The federal-based exchange Indiana has opted to participate in beginning in 2014. And then premium and cost-sharing credits available to individuals with household income between 100% and 400% of the federal poverty level. So public state exchanges. This gives you a perspective across the nation what states are opting to participate in the federal exchange, the partnership, and the state exchange. As you can see here, with the states that are located in kind of the yellow color, it's quite apparent that many states have opted into the federal exchange. A few reasons for that is, the continuing uncertainty around, the requirements, the processes, the procedures, how states are going to manage within the exchanges, as well as the administrative costs. There are going to be requirements that exchanges will be responsible for in terms of communication, online administration, and many states with the uncertainty, I think, were opting into the federal-based system for additional support. So to give you an overview of public exchanges versus private exchanges, the public exchange, again, is mandated under PPACA. All states must comply in one of the 3 ways we discussed. In the public exchange, individuals will have access to purchase health care coverage. Small businesses will also have access. Currently, that will extend to small businesses under 50 full-time employees, will extend to employees to 100 and beginning in 2016, and then all employers, as slated in 2017, will have access to the small business or SHOP exchange. SHOP stands for Small Business Health Options Program. So the public exchange, while it may be managed at a state level, a federal level, or at a partnership, there still will be substantial carrier involvement. And by carrier, I mean insurance company. So insurance companies will file programs, file plans similar to what they do today on a state level to participate in the exchange. Insurance companies are not required to participate in the exchange. This is another avenue for them to gain market share, both on an individual and a small group basis. Within the exchanges, individuals that fall between 100% and 400% of the federal poverty level could qualify for federal premium and cost-sharing subsidies. So individuals, if they qualify, can opt into the exchange, elect coverage under one insurance-based option, and possibly receive premium assistance and or assistance with out-of-pocket expenses. And again, these will be managed at both the state and federal level. Some of you may have heard about a private exchange. Private exchange are also sponsored through insurance companies, but these have much more employer involvement. They're actually employer-sponsored health plans, giving access to or through the carriers to a variety of different programs where they can define a contribution, meaning on an annualized basis, employers can set the monetary amount that they will be willing to contribute to an employee's health care coverage. And through the private exchanges, employees can then go onto the private exchange and elect coverage based on their risk tolerance and need, and then using the employer contribution to offset the premium expenses. These private exchanges are sponsored through insurance carriers or third parties, traditionally more fully insured but can be self-funded. And something to keep in mind within the private exchange, because they're employer-sponsored, employees are not eligible for federal subsidies. So unlike the public exchange where an employee can, if they qualify, they can go on to the public exchange, elect a benefit plan through a variety of insurance carriers, and potentially receive federal credit for premium and out-of-pocket expenses. In a private exchange, no federal subsidies are available. So now we're going to talk about functions of the exchange. You think about the exchanges coming into place, who's going to administer it, who's going to communicate it. So administratively, at a state and or federal level, there will be requirements to certify. There's an administrative function that will be carried out to certify that the health insurance options available through the exchange are considered qualified health plans. They will need to meet certain standards as it relates to the actuarial value and essential benefits. Exchange administrative functions will also determine eligibility. And by eligibility, we're referring to the amount of subsidies that a person may or may not be able to receive. Individuals, whether or not they receive a subsidy, can still elect coverage within the exchange. But part of the administrative function will be to determine and to assist individuals in obtaining federal subsidy if they qualify. Additional administrative functions, as you can imagine, will include a toll-free information line. Employees are going to need to have various access points to ask questions, to navigate their options through website portals. Administration will need to determine eligibility for Medicaid or other insurance-based options or health coverage options for employees, and as well as employer reporting. So if individuals go out and elect coverage within the exchange and are currently employed, there are some reporting administrative capabilities that will need to be put in place to make sure that an employee does not have affordable, credible coverage with an employer, therefore potentially disqualifying them from federal exchange subsidies. They will also be responsible, the exchange function will also be responsible for educating consumers through outreach programs, through web-based or telephonic enrollment options, community-based programs that will help individuals understand what their options are through state and federal exchanges. Health insurers' role within the exchange, as I mentioned earlier, it does require carrier participation. So you may see carriers similar to whom you do business with today. Anthem, Cigna, Aetna, the variety of insurance carriers that will, at their own discretion, be able to opt into providing coverage or providing benefit options through the exchange. This is determined on a state-by-state basis. So you may have, if you have employees in multiple states, they may have access to coverage through United Healthcare, let's say in Wisconsin. But Indiana, because it's a state choice, they might not offer it. United Healthcare might not offer exchange-based programs. There's also a plan approval process that health insurance carriers will need to follow. Similar to the fully insured plans that they have to file with the State Department of Insurance, for those states that opt into the federal exchange, it creates a different layer, another layer of approval and or administration, where insurance companies will be required to file plans with the federal exchange. Upon approval, they will then need to be filed with the State Department of Insurance for additional approval. PPACA requirements for essential benefits and actuarial values will continue to apply. And then through the insurance carrier's platform and the products that they make available, they will also need to make sure that through the administrative process at the state or federal level that they're applying premium subsidies for individuals that qualify for premium subsidies and for out-of-pocket expenses. So as you think about what type of plans insurance companies will be offering within the exchanges, some of you may have heard or be familiar with the metallic-based plan options. So under PPACA, they're kind of categorizing plans into 4 different tiers. Bronze level of benefits meeting a 60% actuarial value, which for employers that's an important concept to understand, as there are requirements for to avoid penalties on the employer side that will require minimum benefits of a 60% actuarial value. You have silver-based plan options, gold-based plan options at a 80% actuarial value, and then platinum, which will be at a 90% actuarial value. So household income distribution. As I had mentioned earlier, subsidies are available for those individuals earning between 100 and 400% of the federal poverty level. That's often a function of the number of individuals within a household. So this is an illustration to give you a perspective on the range of household income distribution that employees might have to be eligible for subsidies. So for example, an individual of a household of 1 earning $11,490 per year would qualify for federal subsidy. For individuals within a family of 4 at a 400% federal poverty level, so at the top end of the threshold to receive subsidy, that annual household income is $94,200. To give you a perspective on the amount of subsidies that consumers may be eligible for as a function of household income, they break it down into several ranges. It is a sliding scale, again, based on household income as it relates to the federal poverty level. And as you can see, the greatest number of individuals are advantaged under that 250% of federal poverty level. So the closer you are to 100%, the more federal subsidy you will be receiving. And if you have individuals within your employer programs or consumers that are eligible for Medicaid, they will not qualify for federal subsidy. So exchange notifications. Now we're going to switch gears a little bit and talk about what employers are responsible for. So as many of you may have heard, the notification that was due to come out in March that employers were required to communicate to employees relative to the exchanges has been delayed. We expect that that notification will come out in late summer or fall, but employers will have an obligation to help employees understand what their options are. They will be required to provide written notice of the existence of exchanges, so explaining to them what exactly is an exchange, what are the programs within the exchange that they may or may not have access to and or qualify for subsidy. They will need to provide explanation in terms of their current employer plan and how that compares and or relates to the exchange relative to if an individual may qualify for subsidy. And then notifying an employee if they were to elect coverage in the exchange that they would then lose the employer-sponsored coverage that would be available to them at the employer level. Exchange open enrollment begins in October of 2013. So as you can imagine, we really don't have a lot of time between, for this being the middle of February recognizing that many plan benefit options renew in January, employers start planning earlier and earlier every year. And this will just be another or an additional administrative requirement that they will need to continue to communicate throughout the later part of the summer and possibly during their annual open enrollment, so that individuals recognize and understand what the individual mandate is beginning in 2014 and what exchange options are available to them. So taking that a step further from an employer perspective, as we talked in the first session, for those of you who attended, if employers are wanting to eliminate the risk of being faced with potential penalty, their plan of benefits needs to meet two requirements. First, we talked about the plan actuarial value, so that bronze level of coverage. So employers must have at least one benefit option that meets a 60% actuarial value. The second qualification is that coverage needs to be considered affordable. And the definition of affordable is that employee-only coverage, the cost of employee-only coverage, is less than 9.5% of an individual's annual household income. Recently, the IRS came out with 3 safe harbors. As you can imagine, many of you might not know what the household income is for your employees. You may know that they're married, but you might not know what that spouse's earnings are. So what the IRS has done is given employers some opportunities to put in place some safe harbor approaches that, in effect, if they were to follow, will eliminate their risk for subsidy. They can do that in 3 different ways. First, they can base that 9.5% premium on an employee's annual W-2 earnings. And as you can see here, what we've tried to do is put it into perspective of the W-2 earnings listed from 100% to 400% of federal poverty level. We also take that a step further, and another safe harbor approach is basing that 9.5% contribution on a monthly income. That monthly income is determined based on the annual W-2 earnings just divided by 12. And then for those of you who have an hourly workforce, breaking that down one step further, is taking that monthly income divided by 130 hours per month. And what that indicates is you have hourly employees working on average 30 hours a month, so we use that as a benchmark. And we correlated that with the hourly wage or corresponding hourly wage. So as you can see, to put into perspective the level of premiums that an employer could safely apply or safely charge employees for employee-only coverage to avoid penalty at 100% federal poverty level is just over $90 a month. And then up to 400% of federal poverty level, employee-only coverage could cost an individual $466 a month. If one of those safe harbor methods are applied, and again, I would encourage documentation of the process that you're taking and the steps in which you're applying the safe harbor. If an individual fell outside of this particular area, but you attempted to apply with the safe harbor approach, they went on to the exchange and they applied for federal subsidy, you as an employer would not be penalized. So now we're going to talk a little bit about Medicaid expansion. As we saw back in June of this year when the Supreme Court upheld the health care reform law, a couple of things did change. First and foremost, Medicaid expansion. This was a pretty significant point of discussion during the debates, that states originally were required to expand Medicaid to those with household income less than 130%, 38% of the federal poverty level. Originally, this was contingent upon the states being able to continue to receive Medicaid funds for current programs. As a result of the Supreme Court decision, they took a step back and said, you know what, it's a state's option to expand Medicaid. And if they choose to expand Medicaid, they will receive additional funding to help offset those costs. But the federal government will not be taking away funding for those states who choose not to expand Medicaid. And what's important for employers to understand is if they have employees residing in states that expand Medicaid and they are, of their federal or their household income is below 138% of the federal poverty level, they have an alternative to electing employer-sponsored coverage. So that means people could essentially be migrating off of your plan because they qualify for Medicaid, which would be cost-effective not only for the employer because you're covering less individuals on your plan, but the employees would be financially advantaged as well. Alternatively, for the employers that have employees residing in states that do not expand Medicaid, you serve additional in-migration for employees due to the individual mandate that they don't qualify for Medicaid, so they will be required to either obtain coverage through the exchange or elect coverage through the employer-sponsored health plan. So Medicaid expansion states, this is a little more diverse than the exchange states that we saw earlier, and it's scattered throughout the U.S. And this just gives you a perspective of what states have committed to expanding Medicaid, what states have committed and said that they're not expanding Medicaid, and then some of the states that are on the fence, Indiana being one of those. So as you can imagine, this continues to be complicated. Legislation is updated regularly. Clarity will continue to be coming out and communicated throughout the rest of this year. We may see further delays as we saw with the notification taking place in March. So I encourage everyone that it is complicated. It does require employers to give it immediate attention, to make sure that you're keeping up on the regs, looking and identifying the exposure that you may have as an organization. But I think it's also important to understand that there are practices that can be put in place and things that are important to take into consideration that will continue to minimize your risk and give you an opportunity to optimize your employee benefit programs. And with that, I'm going to hand it over to John Forrest. Thank you.
Thank you, Tracy. Some of this will be a review, and as you pointed out, this area can get complex, and there's financial implications for the employer. So let's take a look. First of all, as you indicated, there's both opportunity and risk. The mandates, as you pointed out, will cause individuals who previously perhaps waived the employer coverage to migrate towards the group plan. But with the overall expansion of access to the coverages due to the establishment of the public exchange and the Medicaid, as you pointed out, there will be opportunities for an employer to do what we call optimize. That is, take advantage of both the employer-based plan and the additional coverage expansion. Here we're going to look at an actual employer group that we did an analysis for. If you look across this graph, the horizontal axis is going to segregate the employees by their household income as a percentage of the federal poverty level. If you look at the vertical axis, this is going to indicate the actual premium and the cost sharing that the employee pays. These blue lines that you're looking at, these represent the employee's actual premium contribution to the plan. Now I'm going to bring in their out-of-pocket sharing on the cost. Now we're seeing the silver plan that the employees would purchase on the exchange. I'm going to add in their out-of-pocket costs here. And this is the tax implications for paying for the coverage on a post-tax versus a pre-tax basis. As Tracy pointed out, as you look towards the left end of the graph, or those particularly under 250% of poverty, you can see that the line that shows the silver coverage on the exchange is shorter than the bar for the employer-sponsored plan. In other words, less costs. This is the bronze plan, by the way, which would be a little less than the silver. There's the employee distribution. So from that graph, looking at an actual employee that falls in the income range between 0 and 138% of federal poverty level, that employee was paying $3,700 annually for the employer-sponsored insurance and their out-of-pocket costs. The same employee going to the silver exchange with tax subsidy would pay $700 for the year. So the employee obviously would save $3,000. In this example, the employer's cost to sponsor the coverage or their contribution is $7,300. So the employer saves $4,300 after paying the $3,000 penalty. So obviously, it's going to be in many employers' interest to take a look at perhaps readjusting their contributions to purposely make the coverage, quote, unaffordable, end quote, for those employees on the lower end of the income scale. So now we've simplified the math a little bit. What we're looking at here is in situations where there's Medicaid expansion and or obviously where the exchanges are, once they're operational and there are subsidies involved, this will create less cost and exposure for employers if they take advantage of this. It would be less cost for certain employees that qualify for the tax subsidy and fall into certain income brackets. We call that a win-win, and it's something every employer needs to take a look at. Tracy?
So as we discussed before, healthcare reform continues to be complicated. The interrelated parts continue to cause employers to think about compliance, the financial impact, and strategy. John talked a little bit about how employers can optimize the employee-sponsored coverage that they have available. What portion of their employees might be better off or more advantaged receiving subsidy through the exchange. Recognizing if an employee receives subsidy through the exchange and employer coverage is either unaffordable or does not meet the minimum actuarial value, there's a potential penalty. But I think what's important to recognize, penalties aren't always bad. I think it's, certainly an employer-by-employer decision to really sit down and evaluate the programs that they have available, the overall financial exposure that they might have, and then recognizing the value that can be brought to their employee population. This goes into Medicaid expansion and exchange options. How will different states react? If you have employees in states that expand Medicaid or in states that are run through a federal exchange versus a state exchange. And how are those benefits valuable to your employees? As each gear continues to shift, as you can see in this visualization, all of the gears move in one way or another. All parts are interrelated, and it's important and very critical that employers take a very broad overview at healthcare reform and just how it will impact their overall organizational goals. So with that, we're going to go ahead and open it up for questions. I appreciate your time and attention today. Our next webinar series is set for 2 weeks from today. The financial piece will focus on, for those of you with small employers, we'll focus on the financial implications that will impact you, and then we will have a second session that day with an overall financial overview for those larger employers. So we thank you, and we'll open it up to questions.
We have a question asking about a copy of the slides.
Okay, we've got a question about the slides. The slides and the presentation will be available on our website later today or tomorrow.
Find information about premium costs and exchanges.
We have another question relative to the premium cost within the exchanges. You know, insurance companies are diligently working to evaluate what benefit options might they make available through the exchange. Not only do they need to file benefit plans that meet the metallic-based requirements of the bronze, the silver, the gold, and the platinum, but they also need rates associated with those plans. As we talked about in the first series, you know, insurance companies and their underwriting departments have become more restricted beginning in 2014 in how they can rate adjust and account for adverse selection within their insurance-based options. This isn't changing as a result of them offering coverage through the exchange, so they still need to be able to price products competitively within the marketplace so that individuals can elect it. The estimates that we've shown today are through a national actuarial firm, Milliman, that we've partnered with, that works very closely not only with state governments but also the federal government to give us a perspective on what we might see in terms of federal subsidies that will be available within the exchange. I think that's all of our questions for today. Again, we thank you for attending. We will post the slides as well as a replay of the webinar on our website. And additional information relative to Apex benefits and our healthcare reform resources can be found at www.apexbg.com. Thank you.